So lifestyle modifications to consider. Obviously better sleep quality if you can. I know that's really hard with a baby. So try to find time for yourself to slow down before you even try to go to bed. You know, if you're someone who has a hard time falling asleep, scrolling on your phone isn't going to help you there. Watching TV isn't going to help you. Try to take some time to breathe, even just doing some cyclical breathing in for, 4 to 8 seconds, out for 4 to 8 seconds. Spend 5 minutes of your time doing that before you wind down. That should help. Take a bath or a shower before bed. That helps cool your body temperature down so you can sleep a little easier. And then add lavender oil maybe to your bath if you have time, or just sleep with some lavender oil. I did talk about that in the previous module. That Serenity sleep system has all that, and it really does work well. Gentle exercise is going to be good. So walking or pelvic strengthening at this point, and gentle core. So maybe doing glute bridges, but with proper form, where let's say you're on your back, you try to push your low back into the ground to where your posterior pelvic tucking your pelvis. You're not going forward. You're not rocking everything forward where you have a sway in your back. When you do this type of exercise, you want to almost think of how a ballerina tucks their pelvis under and then doing these exercises. I give these exercises a lot to my in-person patients, where they'll also wrap something around their waist to help with diastasis recti, and just doing gentle movement. That will help with your mood. Get sunshine whenever you can. We go back to the nutrient deficiencies. Vitamin D is a huge one. So really the best way to get that is through sunshine. So hopefully, once you start supporting yourself, if you're at the stage where you just can't get out of bed and you're so depressed, hopefully you'll start to feel better soon and you can get out and just even lay in the sun for 10-15 minutes if possible, if you have sunlight where you are. Focus on good hydration. I use something called AquaTrue. It's a reverse osmosis filtration system. Really and truly, you want to make sure you're getting filtrated water, because there's so many different things called endocrine disruptors in the water systems if it's not filtered. And sadly, typical filters or cheaper filters like Brita doesn't quite get all that out. It just gets heavy metals out. So if you are really struggling with hormone issues, at some point you're going to have to switch over the water filtration to something that's going to remove that to really optimize your health. You can, hopefully you have one already. I would say start with the supplemental supports first, and then you can do this later, because we want to make sure your energy is good so you can take care of your family. But that is really something to consider. And if you have more questions about that, please let me know. And then I mentioned this before, stop mindlessly scrolling. So that's not doing anything for you at night. Really, it's a quick dopamine hit whenever we pull out our phones, but this can ultimately end up in you having a lower mood. And then something that has really worked for myself and for patients is to listen to hypnotic recordings as you're falling asleep. So there are some online for improving anxiety, for improving your mood, improving self-image, which can sometimes be hard for moms as their bodies have changed and they're trying to find, what their new normal is or back to how they were before. And that can be really hard to deal with. So listening to these things, a lot of times they're full of positive affirmations. And the whole point of listening to a hypnotic recording before you go to bed is it's actually kind of a hack to meditation. Because when let's say you're a really good meditator, you tend to fall into something called a theta brainwave state. And that's when you can rewire and create positive new thinking and new beliefs. When you are falling asleep, you also go from your active brainwave state to then your sleeping brainwave state. You pass through theta to get there. So if you're trying to rewire a new way of thinking, then that is the best time to listen to something. So that's just a little hack for you. Let's say you want to go get labs. These are the common ones that I will order. So, and I have another handout that explains these lab tests and why you would order them. So you can look at that too. So this is just quick. So a metabolic panel, a complete blood cell count. There's like immune markers in there. Your hemoglobin A1C, insulin, so like blood sugar related for both of those, vitamin D, iron, omega-3s, vitamin B12, homocysteine, full thyroid panel. So I said I would talk more about this. So most patients that I see when they bring me their labs from other practitioners, they've only had TSH and like T4 drawn. It doesn't give me a lot of information. So if you're going to do a full thyroid panel, let's say you take the advice I've given here and then you want to explore this further, maybe just do a general CMP, CBC, and a full thyroid panel so you can take it to whatever practitioner you want to work with and have them evaluate that information for you. Please don't evaluate these labs on your own. The lab guide is really just to help you make more informed decisions on which labs to run. We went to school to interpret labs and to put this whole picture together for you. So please don't try to interpret it on your own, or, go get licensed in that area or certified in order to do so. I'm all for it. So when you want to get your thyroid panel done, test for all of these, okay? And then a lipid panel, super helpful. ApoB, I talked about that in the lab guide, and that's actually a better indicator of where you are at for cardiovascular risk. And then hormone testing. This is just a quick summary of when you would test certain hormones and why, which days you would test them on, because there's better days to test certain hormones to get you a clear picture. Cortisol isn't as important for getting the correct day in your cycle. Also, let's say you don't have your period back yet. This isn't as important. And if your doctor's trying to pull labs just to see what hormones your body is producing through a blood test, then don't worry about that so much, because you're not having a cycle, right? You haven't had your period return. If you have had it return, then try to follow this guide. If you're wanting to get a Dutch test, I think that's really accurate for seeing what hormone metabolites are in your system. And once again, get with someone that can read those properly for you. And I put more in that lab guide for you to determine if that's what you think is best for you. So congratulations, you've completed the course. I really, really hope this was helpful for you. I wanted to make this course so that women could feel more empowered from, the state, from their homes, and not have to, especially with a new baby. It's hard to get out, first of all. If you are depleted and can't get out of bed, the last thing you want to do is go see a doctor who maybe isn't listening to you and maybe isn't giving you the time of day. I wanted to give you guys a really good overview and break down why your bodies feel this way. And truly, this information I've given you isn't just specific to postpartum. I mean, it is, but you can use this information and the symptoms of those stress stages to evaluate yourself at different stages of life. So I really, really hope this was helpful. Reach out to me for any questions or feedback. I'm here for you guys. Once again, none of this was meant to diagnose, but really strictly to educate. But with this information, you should be able to go out, get the support that you need in order to start feeling better quicker, versus for hoping and giving it time for your hormones to bounce back, which, yes, sometimes they do, depending on which stage of distress you're at. But a lot of times women don't have to sit and suffer and hope for the best and hope that they bounce back. I know a lot of women that haven't. So I hope that this course provided you with something that you can take away and start feeling better really soon. Okay. I wish you all the best. Thank you.